Hello, this is April 17, 2020, Friday. It's reporting at 9:30 p.m. CST. Today also we are having a grim day. A lot of deaths happening all across Europe and in America. Many other countries are also contributing towards the death and the total cases that we are seeing. But I think that's the new order. We will come out of this very strong, but at this moment, this is what we have. I'm having a background music at this moment just to make sure that people are saying that these are very monotonic and then does not lift the spirit of anyone who is seeing it. Mostly that is me. I think just wanted to have a positive dent on that. Despite all these things that's happening around, but I think these are the things that we have to learn from and then try to come out of this strong. Yeah, with that note, I think I would like to give my updates. I'm pretty good. So I have been exercising as usual, doing pretty much the research and oriented stuff, isolating myself at home. Pretty much it was a great productive day for me. So far, everything is looking good. I think I'll have a couple of more, tough working days coming up because I think I'll have a deadline to meet really soon. Apart from that, I talked to my parents. They're doing excellent. Lockdown has been extended for a little further, and state government is actually having a plan in order to open up the economy in India, but that is in a multifaceted way. But I think that is a very good plan that they have. That there are some places in my city where they are going to have absolute lockdown. But I think that is all for the good, since as long as we don't have the antibody test as well as enough facilities to ramp up the testing all across India, I think it is one of the necessary moves to clamp down some of the cities and necessarily open up those places which are absolutely essential. Talking about my brother, sister-in-law and kids, they're doing great. Talked to some of the cousins in Qatar, they're also doing good. They are also sitting at home mostly, and it's their shopping day for my brother, sister-in-law and kids. So I think they are ordering everything online from Indian store as well as from Whole Foods or Costco or whatever place they shop. They have some other stores called Fred Meyer and all that nearby. So they are doing good. My friends are doing excellent. I think all my friends got all the groceries yesterday. We tried to order something from a very conservative store from the who are supplying this Indian related groceries. These groceries are very essential and key in running many households with children and especially with children and elderly people living in their home. I think these people are charging almost $50 for delivery for one single order. I think they are shipping it through FedEx. That is one of the reasons why they have an exorbitant price tag on the shipping. Anyway, it did not work out well for us because I think $50 is way too much for us. So apart from that, I think we are doing great, and probably we will be looking forward to some shopping maybe early Monday or something. But I think that will be a good time for us to shop to get away from all this busy, crowded shopping experience. Everybody's social distancing, that's great. So I'll just go into the numbers really fast. Total cases 2.21 million all across the world. And 95,000 people were positively identified today all across the globe. That is really a big number, but that's the new order that we have. The main aim is to keep this as 95 or bring it down. Total number of deaths is 149,920. It's very close to 150,000 deaths in total all across the globe. Globally, we have recorded 6,990 deaths in total so far. That's really staggering. That's really bad. Total recoveries are 561,057. These numbers we are seeing almost by the number of cases, almost increasing by the number of cases that we add. So that's a good news. So as long as we are adding equal number of people who are coming in and equal number of people who are going out, I think that's a delicate balance, but I think that's a good balance that we have at the moment. Number of people who are still battling, 1.48 million people. 56,602 people are actively battling in various essential cares like the intensive care units, sustaining their life, supported through the various apparatus that they help them to breathe. Cases by country. So we will like to add, United States has 667,000 people. 29,000 people were tested positive today. Spain, 184,000 people were affected so far. 4,289 people were infected today. Italy, 168,000. 3,786 people infected today. France, 165,000. 17,000 infected today. That number is going way too high. We do not know what is happening in France. One day the number is very low, one day the number is very high. So the trend is, I think it is going up. That's what we see. Germany, 137,000, 2,900 deaths so far. For Turkey, these are the top 5 countries who has the total cases, but Turkey is a country that is like very, very in a bad shape. 74,000 cases and 4,800 new cases added today. UK is also doing a very is having a very bad day. I think the spread is really high. 103,000 people have already affected and 4,617 cases were reported today. I think if you can bring UK rates low, I think that will be one of the biggest achievements that they can do, despite having to go away from European Union and stuff. Deaths staggering once again. United States, 34,617 people died so far. This number is really, really high. 2,174 people have died today. That number is really staggeringly high. We are expecting these numbers to come down. They are adding the further corrections of all the people who have died of various reasons, if they are testing whether these people actually had COVID or having symptoms of COVID at any point of time. Italy, 22,120 people died, 524 people died today. So we have not seen a number which is less than 500 for Italy for a long time. Really, really alarming for such a small country with a small population, having this much deaths being attributed to COVID. Spain, on the other hand, 90,315 people died, 503 people died today. That's also very high. France, 7,920, 753 people died today. UK, 13,729, 861 people died today. That number is also really high. I forgot to add the trend lines from yesterday. Actually, when I prepared the data, I had multiple phone calls and stuff like that, so I just missed it. When I just looked at the image, when I started recording the video, I realized that I did not add it, but that is like one of the things that I will try to incorporate tomorrow onwards. One of the important things is the death toll approaches 150,000 people all across. So these are not numbers, these are human beings who lost their life, and solid confirmation that they had symptoms or tested positive for COVID. Generally, I think the numbers are really high, but these are the numbers that we will have. One of the good thing is, and bad thing about the antibody testing, World Health Organization is very confused about whether the antibody testing is actually working or not. They are really worried whether this infection help these people to acquire immunity or not. There are a lot of questions and answers. They wanted to answer questions which are more relevant at this point for this infection, but they are unable to do in many of the cases. So recovery from this disease, does that provide enough of guarantee on the immunity side of it? So, and also one of the other things is that in California or in other places, antibody testing has come up and people are testing. The results are a lot more positive than actually we thought they were. That's one of the news that we have. A lot of people had COVID, but they did not have symptoms, but they would have become the silent carriers of this disease to many other people, which is also equally important to tackle and then address at this moment. China, on the other hand, has readily said that they are increasing their death toll, previously attributed to some other reason, to the death toll actually attributing to COVID-19. But the numbers are really staggering. So they almost added 50% of what they had. They had roughly around 3,000 cases, which was attributed before. They added 1,500 close to the new total, which is always staggering. It's confusing. I really don't know what they are doing. So that is like one of the things that I'm not attributing myself to get into this politics of it, but it's a good idea to have, from a disease point of view, from a research point of view, from data analysis point of view, to understand how much is the depth and what is the percolation rate, what is this actually a pandemic is going to cause a havoc across the world, and what are the effects. How can we tackle this? These are all questions that we need to ask ourselves before we prepare for another pandemic. There is no guarantee that this will be the last. There could be many more in the coming future. We'll have to come together in order to tackle all these things. We'll have to be understanding. We'll have to be self-reliant. You will have to be depending on others only for things which are absolutely important. We'll have to work as a closed community. We'll have to obey to these social distancing norm for a long time. But things will be all better to get tomorrow, and I think it will be like much better to have such a hope at this moment. And the world, we will have to work together with other people from other countries and other research areas. We will have to find out a new, probably a research area. I think many people are working on this research area where you can use the technology that we have currently having, extend it to predicting these events which are not properly accounted in usual cases. We will have to understand the social impact. We will have to understand the economic impact. We will have to see how we can come off this kind of scenario. What is the global preparedness level that we have? What is the, in what states and in what manner we need to establish the norms that whether this particular disease has to be a pandemic, how to declare these diseases as pandemic, and then how to have healthy habits among people, like exercising and eating the right set of food, eating the eating the right amount of food. All these things contributes a lot to the death rates, the number of people who are dying and all that. So we wanted to understand all these factors to have a general preparedness for and interdisciplinary research on how to find out solutions for these problems, how to find economic viable solutions, how to find solutions which are far-reaching, solutions which are scalable. We want to understand about all of these things. These are research perspectives that we might have. So I think we will have to see. I think I'll be really happy to look back into these videos from 10 years or so, just to understand that what was the state that we had today, and what we have gone through, and then what we have endured, what we have endured, what we are having to see at that moment, and how we are going to see it, and what are the new norms, and then how the world has evolved, how the world has to cope with this thing, and all those things will be very interesting for me to see and experience. I'm more excited to do that. Thank you.